We're going to go ahead and get started, folks. So thank you all for joining us. Welcome to this webinar, Realizing Safe and Sustainable Wash, Waste, and Energy Infrastructure for Quality Care, Post-Summit Reflections and Plans. So please go ahead and introduce yourselves in the chat. As a reminder, this session is being interpreted in French, Spanish, and Arabic. So if you select the little circle at the bottom, the world interpretation, you can choose your language. I encourage you, even if you are listening in English, to select English in case we have any comments in another language. So we'll go ahead and get started. It is right on the hour, so I'll go ahead and hand over to Ann Thomas of UNICEF to kick us off. Thank you so much, Ann.
Great, thanks so much, Lindsay, and welcome to everyone this morning to our webinar hosted by WHO and UNICEF. It's exciting to see everyone on this important webinar, and particularly for those colleagues who didn't get to attend the summit in Jordan. I think this will be a really great session to catch up on some of the discussions and some of the emerging direction going forward. My name is Ann Thomas, Senior Advisor for Sanitation, Hygiene, and Institutions at UNICEF's headquarters in New York. I believe that many of us will have met at the summit or in previous webinars, and I'd like to encourage you to introduce yourselves in the chat box just so we can all see who's joining us from around the world. I believe we have over 500 participants registered this morning, so we look forward to seeing the kind of representation that we have. We will have a Q&A session toward the second half of the session, but I would encourage you to use the chat as we go along to ask questions, and our various panelists can respond to these as we go along. By way of background, in June, WHO and UNICEF, with the government of Jordan, hosted a global summit on wash, waste, and electricity in healthcare facilities in Amman, Jordan. The summit was the first in-person global meeting on wash and healthcare facilities to take place in 4 years, following the last global event held in Zambia in 2019. With 125 participants from more than 35 countries in attendance, the summit brought together a diversity of partners, including experts from wash, energy, climate, and health sectors. The summit also offered a platform to exchange experiences and to initiate the global plan for the next phase of work in healthcare facilities. During the summit, WHO and UNICEF launched the Global Progress Report on Wash, Waste, and Electricity in Healthcare Facilities. And the report summarizes global data, provides an update on the 8 practical steps, and it identifies key areas for action. The purpose of this webinar is to further disseminate experiences and learning from the summit, particularly for those who were not able to attend in person in Jordan. We will be sharing highlights from the Global Summit, the Global Progress Report on Wash, Waste, and Electricity in Healthcare Facilities during this webinar. We will then reflect on the actions needed as we look toward 2030. So you'll be hearing from several speakers this morning. Just to go through a little bit on the agenda, we will start with Helen Hamilton from WaterAid. We'll then hear a little bit from whom we'll hear about the summit and some of the highlights of the summit. We'll then hear from Dr. Maggie Montgomery, who will talk about the Global Progress Report. We'll hear about some of the recommendations from a few speakers, Maria Chino, Arabella Hayder, and Irina Mungen. And then we'll have a facilitated Q&A that's facilitated by Bruce Gordon, along with the closing remarks. So we've got a great program ahead for you. And let me start by handing over to Helen Hamilton, who's a Senior Policy Analyst for Health and Hygiene at WaterAid, who'll give us a summary of the summit. Over to you, Helen.
Great, thank you ever so much. So I was privileged to attend the summit. And I think for all of us who were able to attend, it was a really valuable experience. So I'm delighted to have the opportunity to provide feedback and an overview on some of the key outcomes and the key highlights. If we go to the next, so the summit was held in Jordan, and we came together for 3 days, as the slide says. There was, the launch of a report. We heard from colleagues from around the world, from all different WHO regions, in different, from ministries of health, from development partners, from NGOs such as WaterAid. and a whole range of other participants. And I think it was a hugely timely meeting, in particular to share sort of learnings, reflections, and where we've got to as a community in terms of advancing this agenda, but also to have a hugely important opportunity to reflect on where we need to go next. So if we go to the next slide, please. Thanks. So yeah, so we had 125 participants from 35 countries, which highlights both the diversity of the inputs, but also from the discussions. And there was a huge range of different areas that we were able to hear from, in particular around climate smart interventions. We heard a lot about national experiences, so particularly budget tracking. So we heard from colleagues in Ghana on sort of budget tracking leadership and accountability, from Zimbabwe on costed roadmaps, but also from colleagues in Jordan as well. There was a huge focus across the whole summit on the need for more political action and financing focused approach, and that this needed to really come from sort of country level all the way through the work that we do. We also looked at regional progress and sharing different approaches and experience on data, including how to really ensure that data is informing policymaking. We looked at emergencies, and we had colleagues from other sectors of WHO and other sectors across the health sector to really think through how do we take an action-orientated approach to addressing, maybe some of these older problems, but really try to make sure that we're coming at them in both a climate smart, but also a health system strengthening approach. And across the summit, there was significant discussion about the need for a multi-sectoral approach. The fact that there are several health platforms there are a multitude of health platforms that WASH in healthcare facilities and the focus on power can link to, but that some of the ones that provide the most viable, and I think the highest opportunity for success and for collaboration, really centered around maternal and child health, primary healthcare, antimicrobial resistance, and infection prevention control. And that's not to say they're the only areas that WASH and power in healthcare facilities could link with, but that they're some of the best opportunities for multi-sectoral collaboration and novel approaches. As I've highlighted, there was, I think, the strongest focus, certainly to date, on making sure that there's really good integration with solar and electrification, and linking this fundamentally to the climate change and climate resilience agenda, and making sure that it's really well centered within that arena. And finally, again, as I started with, just bringing together ideas around and lessons from WASHFit, but also thinking about how we build up both experience and the evidence base and lessons around costing and financing efforts, in particular for national roadmaps, but also thinking more globally in terms of how we get broader investment. So go to the next slide. Thank you. So I know Maggie's going to, I think it's Maggie, we'll talk about this later, but we also had the launch of the latest report, which again highlights to us the importance of political will, of strong leadership, and financing in order to achieve universal access to WASH in healthcare facilities, but also highlighting just the immensely highly cost-effective and the impressive health benefits. So the highly effective cost nature of investing in WASH in healthcare facilities and the substantial health benefits that can be drawn from it. And that this represents a huge opportunity both for maybe our smaller community, but also the wider health sector and others, to really focus on sort of a winnable battle and a really achievable challenge. Next slide, please. Thank you. So we heard from countries with 33 posters that tracked all the many different major achievements, that really investigated some of the specific challenges that have been highlighted, but also what was needed in terms of next steps to accelerate progress. And I think there was a really great opportunity, if we go to the next slide, to then translate these stories and examples that were shared by country programs into something that we called the action wall. And this is where countries were able to share what should happen next. Where should we go now, and what should we be focusing on? So if we can jump 2 slides, please. And again, in keeping with the action-orientated focus of the meeting, the action wall highlighted areas that we can really prioritize and focus on, including technical and research areas, an increased focus on political engagement and advocacy, as well as financing and leadership aspects. And I think overall, a much stronger focus on integration, as I said, with the wider health sector and on health systems and financing. And so you can see on the screen a number of the different areas that were highlighted, healthcare waste management, good practice for implementation, for operation and maintenance, and again, greater integration with the energy sector, and of course, financing, to name a few on the areas that we need to focus more on, but also what we need to look at within the Global Action Plan. So making sure there's much greater ownership and institutionalization by health sectors and leaders, really making the most, as we have done with the World Health Assembly resolution, of the new UN General Assembly resolution for accountability and reporting. So making sure that, where we do see these opportunities for political engagement, we're using them to their greatest strength, making sure that we're engaging on local awareness and leadership and capacity building, and really having a focus at different levels of regional accountability as well as national and global. And finally, understanding how exactly we build a much stronger picture around engagement of financing institutions and articulation of how to best scale up different models. So there was a huge focus on, as I said, this action-orientated approach. What is it that we can do together? How can we bring all these different strengths, but also try to adapt to some of these gaps and really respond to them as rapidly as possible? If we go to the next slide. So we also have we had a number of videos and social media slides, which I think if we go one more slide, we can see some of the talking. Yes, some pictures of some of the superstars from the different social media videos. So please, if you haven't, do take a look at some of those videos and engage with that on Twitter. I know they're still up there, and it's a great opportunity to see different perspectives on the meeting and what different participants were calling for. Okay, I think it's the final slide. So the feedback from the summit, certainly for me from the WaterAid side, and I'm sure for many participants, it was a hugely valuable and timely meeting, with the last reporting back from the World Health Assembly happening in May, and a huge number of opportunities on the horizon, and feeling certainly like we're beginning to really build momentum around roadmaps, costed roadmaps for washing healthcare facilities and other areas. This summit came right at the appropriate time, and there was some really positive feedback on the summit, so that there was a great learning opportunity and a huge chance to share all these different lessons across countries, and that we had a really interactive and engaging agenda, but that, as ever, I think there was a real demand for more focus and more time for skills building, more time for posters, and more review of action wall. So far more, I think, to me, what that says is we all want more interaction. We want more time to meet, to discuss, to build connections, but also to hear and learn from each other. And most importantly of all, far more time for all those valuable country insights, and particularly a focus on financing, which I think was one of the highlight sessions for many of us. Okay, I think that's where I'll pass back to Maggie. So yeah, so as the slide says, this is the moment now, with all that, I think with that pit stop and that opportunity for us to gather up our energy to really dive into some of those areas that we need to make progress on and clarify where the opportunities are, what are the barriers, what do we need to work on. We can now go forwards to innovate, to accelerate, and to progress together. And you've got the link at the bottom to the meeting report for anyone who hasn't had a chance to read it yet. So Anne, I'll pass back to you now.
Super. Thanks so much, Helen, for that great summary, which was very comprehensive and very difficult to do for such a rich 3 days of meetings. I'd like to just once again encourage everyone who's joined. I feel quite a few people have joined the call, and please do introduce yourself in the chat box. I wanted to pass over now to Dr. Maggie Montgomery, who's a technical officer at WHO, who will give us the highlights from the Global Progress Report. Over to you, Maggie.
Great. Thanks so much, Anne, and thanks, Helen, for giving such a great summary. As Helen mentioned, at the meeting, we did launch the report, and I just want to give the highlights. We haven't actually shared it in a webinar yet, because I think it's really important as we move forward to make sure that we reflect on where we are, what the data tells us, but what some of the insights are on where the gaps are. So JMP last year came out with their latest data that's looking at the service levels and healthcare facilities, and we still see huge gaps. 1 in 4 healthcare facilities lack basic water, and this doesn't say anything right about water quality or water quantity. We know there's huge gaps in sanitation as well. We have 1 in 10 that have no toilet at all. So it's kind of hard to imagine that users are continuing to visit these healthcare facilities, and health workers are having to work in conditions where they can't wash their hands, they can't use the toilet, they can't safely segregate the waste. For the first time, we've also added in the electricity component. There's obviously important links to water and sanitation if you think about pumping, about treatment, about heating, but it's a part of an infrastructure package. And again, we see very similar gaps with the electricity side, with about 1 billion people accessing facilities that don't have reliable energy. Next slide. In the progress report, we also looked at the latest country, what we call the country tracker data. Now, these are the 8 practical steps which have been enshrined in the World Health Assembly resolution. They're also articulated in the forthcoming UN General Assembly resolution, which we'll mention briefly a bit later. 5 out of those 8 steps are much more easy to quantify and verify, and those are the steps we're looking at. I really encourage you to go online. We have data now from 73 countries, and all the scoring is validated by the country focal points, and want to thank many of them who are on the call, because I see many familiar names, as well as the partners that have helped get this data. We find it's quite important, not only for understanding where more support is needed, but also to see where countries are and to make sure that we're documenting those strategies that do work. So next slide. So in terms of what the country tracker data tells us, is that we see there is some really important progress happening, especially on the more technical elements. So around conducting a situational analysis, around establishing baselines, even starting to develop roadmaps that have some costing attached to it, and wash and waste standards. And in particular, on the waste side, we've seen a lot of movement to look at not just safe waste management, but how we can do it sustainably, how we can reduce the carbon footprint, how we can produce less waste. So that's really exciting, and I think gives us reason to be a bit optimistic. But when we look at the system strengthening, the work that is needed to really integrate and embed this effort into health systems, health programming, there's a lot more that needs to be done. For example, only 14% of the reporting countries indicated that they're actively managing or monitoring WASH within their health monitoring information systems, right? So there's still huge gaps around the monitoring. If we look at infrastructure, and the colors, by the way, the red means that nothing's been done. The orange and yellow means that the countries have made some progress, and green means that that step has been more or less fully achieved. So again, we see on the infrastructure side, the workforce side, as well as how we're actively engaging communities, not only to assess and give feedback on the services, but also to help plan services that are inclusive, that address needs around certain populations, that there's still a lot more that needs to be done. Next slide. So this is my last slide. There's 3 main recommendations from the report, and we really want to encourage all of you to think about how within your organizations, within your institutions, that these recommendations are being implemented. And very much these will become part of the next global plan, which it will be from 2024 to 2030, as well as the next UN resolution. But the first is really around integration and making sure that it's not just integrated, into some overall strategy document, but that it's within programming, that there's training elements that are embedded in, for example, health programming on child maternal health, or infection prevention control, or on pandemic preparedness. On the financing side, we see there's huge gaps that these services are not budgeted. The what's spent is not actively tracked, and without that, it's very hard to make sure that services are maintained. So that's quite important, and also to make sure that there's joint sector review that's happening. So the wash sector, the electricity sector, and the health sector are coming together to share, to strategize, and really see how they can address some of these gaps. Obviously, monitoring and reviewing is really important, and that needs to be coupled with strengthened accountability. So we've mentioned already the resolution, and that's just one way that we're trying to strengthen accountability at the global level, but it also needs to be happening at the national and the local level. And then finally, the health workforce, they're instrumental in all of this. And not only do we need more dedicated workforce, especially around cleaning, around waste management, to make sure that these services are being maintained, but even among the healthcare providers, making sure that they understand the importance of advocating for, demanding for better services, and also practicing good hygiene, especially around things around hand hygiene. So we've developed a training package around Wash Fit with UNICEF, which helps address some of these issues, but my colleagues are going to talk a bit more about some of this capacity building. So with that, I'll hand it back to Anne. Thank you.
Great. Thanks so much, Maggie. Again, another great summary of something that contains a lot of great information, and really encourage everyone to download that and have a look at the Global Progress Report. I would like to now invite three speakers who are going to talk a little bit about some of the key outcomes from the conference. They are Dr. Mary Ashinio, who is the Deputy Director for Quality Assurance and WASH, and also the IPC focal point at the Institutional Care Division in the Ghana Health Service. We have Arabella Hayter, who is a WASH and Healthcare Facilities Consultant at WHO, and Irene Amongan, who is a WASH and Institution Specialist at UNICEF Headquarters. So over to you, Dr. Ashinio.
Thank you very much, Anne, and hello, everyone. So I'm happy to share the first part of the recommendations and our agreements at the summit. As colleagues presented earlier, that it was really heartwarming to see the progress that had been made, but also where we needed to put in more effort. And so one of the areas that we thought we needed to do more was how to engage leaders and civil society with a holistic approach. And we emphasized that the local leadership was important within countries and at all levels within countries. This should include leaders that we are yet to engage. For instance, there was a lot of talk about colleagues who work in the finance areas, like the ministries of finance, who needed to be part of the facilitative process to ensure that healthcare facilities or every level of healthcare is able to budget for WASH and also would be able to execute that budget. We also had several experiences shared on national strategies. We learned that costing those strategies added more value to the strategy. But one of the things that came up strongly was the fact that even the costed strategies needed to be operationalized, and how those resources were going to be mobilized for the actual implementation of these strategies. And we also agreed that accreditation systems were important ways of sustaining standards of WASH in healthcare facilities. And also regular monitoring and evaluation of WASH programming was one of the things that we thought was extremely important to know where we are and also where we needed to make more effort. So we also agreed that so far we have used high-level forums such as the UN resolutions to be able to I'm sorry. There's a little noise in my background. Just a minute. Okay, so we also agreed that high-level forums have been very useful in advancing WASH in healthcare facilities, and we needed to continue to use these forums as a tool to strengthen global and national accountability and reporting. And I think colleagues will be talking about the UN resolution in a few moments from now. We also agreed that there's a need to strengthen financing, including collaboration with the World Bank. This is an area that I think across all countries, across all the DPs and all implementing partners, it was one of the areas that we needed to look at financing, budgeting for WASH. Then going forward, we also agreed that for the task force version 2, these are recommendations that they need to take up very strategically, very importantly, to enable a very strategic shift and help us to accelerate action to be able to bridge the gaps that we identified in the global report and also at the summit. So thank you for listening. And at this time, I would kindly hand over to Arabella to continue sharing the experience, the recommendations. Thank you. Over to you, Arabella.
Super, thanks so much, Mary. So I just wanted to touch a little bit on this idea about the global community and this collective that we're all part of. And it's great to see so many people already on the webinar today as an indication just of the importance and the continued attention that this issue is getting. Not to mention those 125 participants we had in Jordan from 35 countries. So we already know the community is rich and diverse, and as we are expanding this area of work to areas to include electricity, greening and climate, gender, there are lots of partners and stakeholders who should be and already are part of this collective, but there's certainly more to do to grow the numbers in our ranks. The meeting in Jordan, as Helen already mentioned, was the first for some years. So it was particularly great to be back in the same room as everybody, to exchange, to learn what countries are doing, and to share all the important efforts that are already going on. One thing that came out of the meeting was this clear need to develop some kind of a new community of practice. And there were a number of topics which clearly came up that partners were interested, partners and countries were interested to know more about. And some of those are mentioned there. So around WASH fit evaluation and technical support, on budgets and financing, climate resilience and greening, healthcare waste, that was one that came up repeatedly. Plumbing, safe plumbing, and how that applies to healthcare facilities, and also AMR. So clearly there's a number of topics where people would like more information and more support, and we really look to you to hear from you how you think would be the best way for you to learn more about these topics. So thinking about a community of practice, what that would look like. Should it be a technical webinar series? Should we be having a more informal set of drop-in calls where we have a facilitated Q&A session with experts, perhaps? Could it be an online working group? Perhaps you've been involved in other communities of practice or peer-to-peer learning mechanisms in the past, which maybe you've benefited from. Perhaps there's even other topics in that list which you're particularly interested in and would like more support on, which we should be included. So please do share any thoughts that you have in the chat box. And also we'll share the email address, the WASH and Healthcare Facilities email address. If you've got more detailed feedback or comments that you'd like to share with us, we'd be very happy to receive those. On the country tracker, which Maggie already touched on in relation to the Global Progress Report. So the country tracker is the mechanism which we use to collect data for the Global Progress Report. And it has been really useful to be able to make country comparisons and to highlight to donors and partners where the biggest gaps are. And importantly, it shows countries, that they're part of this bigger effort and this global community working together to a common goal. We recognize that there are certainly improvements that could be made to the tracker, both in terms of what is tracked, but also how the data are collected. And we're currently looking at different options of how we can do this. So what methods to collect the data, whether we can piggyback onto other global monitoring mechanisms like GLASS and JMP, and whether we should be altering any of the metrics that we're tracking to make them more relevant to countries and more easy and more objective to track. So again, with this, we really welcome any feedback. Similarly, via the chat box during this webinar or through our email address. Anybody that's either been involved in producing country data for the tracker, any of you who've read the report, or maybe you've used information from the tracker, or you just feel that you're part of this global community that we want to be, that we're growing. So yeah, please do feel free to drop us a note on any of those topics, and we look forward to hearing from you. So with that, I'll pass to our next speaker, I think is Irene.
Thank you so much, Arabella, and thanks everyone. Good morning, good afternoon, good evening, depending on where you are. This is Irene from UNICEF New York HQ. So, so on this slide on capacity building, we're basically talking about training, but also mentoring capacities of those involved on WASH and healthcare facilities. I think Arabella has taken us through one of the modalities for capacity building, which is communities of practice. But I think here we're talking more about intentional training of those involved in this area of work. So as you can see, these are some of the priorities that we identified from country presentations. But I also want to say that actually these priorities are some of those that we have seen and highlighted during our WASH Fit training conducted by UNICEF and WHO for government and other NGO partners. And so you can see that there's a lot of appetite for capacity building around common themes. As you can see, climate resilience, waste management, water quality were some of the key priorities highlighted for capacity building. In terms of climate change, I think there's more need and appetite for, approaches and technologies to address the increasing climate risks, but also the impacts. And I think this should not be a surprise to us because we see that there's really need for knowledge in this area to ensure that all our WASH services and infrastructure are climate resilient. The other area is waste management. And I think there's appetite for, understanding of the different approaches for managing waste, but also understanding who is responsible for what kind of waste. And I know that during the peak of COVID in 2020, we had developed some resources for webinars. And I think we can share some of those resources with the partners to make sure that we can disseminate, but also translate to people who need these resources, especially at the local level. In terms of water quality, there's interest in water treatment technologies, but also how we can best work with partners involved in this area, special governments, to make sure that water quality is attained as we work towards ensuring that all healthcare facilities meet the basic service level for WASH. The other area of interest is WASH Fit implementation, and there's greater uptake already with 70 countries implementing WASH Fit. Just between 2020 and this year, we've had over 300 participants trained on WASH Fit implementation, and we've done this collaboratively with WHO. And so there's need for continued advocacy to governments and partners to make sure that there's more uptake of the tool to improve WASH services in healthcare facilities, of course, in complementarity with other existing tools. The last one is on partnerships with IPC community and also behavior change, especially in regards to hand hygiene, which is one of the critical challenges in healthcare facilities. And this is particularly important for those providing care. And I think it's just important for us to make sure that whatever resources are available regarding IPC and behavior change are disseminated to the users at the local level, but also that this information or these resources are translated and are available for use by the users at the facility level, but also at the community level. I think there are also other areas I've seen of interest to the Washington healthcare facilities community. And one of those highlighted in the posters was the need for strong community and civil society engagement. But how do we do this? How do we ensure that we engage the community and civil society? I think it's important to go beyond the usual programming on infrastructure, but also systems strengthening, to working more with civic organizations to empower communities so that their voices are heard on what are their priorities, what are their interests, what are their challenges, but also to ensure that they can be empowered to demand for better services, as well as demand for accountability from those who are responsible for providing these services, but also involving, the civil society as well as the community in the whole project cycle, from planning, identification of priorities, to implementation of these priorities, as well as monitoring and evaluating the success of these programs. I was looking at the report from the summit, and I could see that Mali, actually one of the countries that has a good example of decentralized health systems, where community organizations play an important role in terms of managing healthcare and facilitating mobilization of resources to support WASH services in healthcare facilities. The other area I see is monitoring, which, as you see from the JMP report, we still have data gaps in some of the WASH services. And I think this is an area which is important for us to ensure that those responsible for collecting data, analyzing it, and disseminating it are actually supported to make sure that data is available and that this data is quality data. And I think the other area I saw on the reports, on the PowerPoint, on the posters from countries, is emergency preparedness and response. Especially for countries that are prone to emergency or disasters, but also countries that are not prone to disasters, because we need to be prepared for any emergency. So I think this is an area where we also need to ensure that those involved in providing care are knowledgeable about. So in terms of who are we talking about when you talk about capacity building, I think there's more interest to make sure that these resources and knowledge is available to those involved in providing care at the local level. I think it was Helen and Arabella who talked about, local capacities, or no, Dr. Shinyo, who talked about, building the capacities of local leadership, but also building the capacities of, the healthcare facilities at the local level. So we're talking about all those providing care, but also those who support in terms of maintenance and cleaning healthcare facilities. But also, we also want to make sure that we identify champions at the local level to champion some of the priorities that we see as priority. Things like climate resilience, but also IPC, as well as emergency preparedness and response, all of these issues that we have been talking about. So having champions at the facility level, but also community level, would help us leverage efforts around providing WASH services in healthcare facilities. So I think that was it. So back to you, Anne. Thank you.
Super. Thanks so much, Irene, Arabella, and Mary. I think those are great takeaways from the conference. I'd like to just encourage everyone, because we're going into our Q&A session and we have a couple of speakers lined up, to put your questions into the chat box. It'd be great to hear from you. I see we've had a few questions and a little bit of chat going on, but if you do have any questions or thoughts about some of the content that's been presented, we'd love to hear from you. And we've got some great panelists who can also share their thoughts on any questions you have. So without further ado, I'd like to pass over to our moderator for the Q&A session, Bruce Gordon, who is the coordinator of the Water Sanitation Hygiene Group at WHO. Over to you, Bruce.
Okay, thanks so much, and thanks everyone. I know it's a lot to absorb if you weren't, in Jordan, and of course you've read the report. Maybe just to start with, what I'd like to do is, before inviting our speakers up, I'd like to just give you a little bit of a summary on the, where we intend to go as far as the two issues. One is and I think there's a slide on this, so maybe we can quickly put that back up. So what is going to stay the same, what's new, and what's a timeline? So we have two, I think, big issues that we really intend to kind of work with, and one is a UN General Assembly resolution, and the other is an action plan. And as you all know, we've been working to an action plan that really responded to the World Health Assembly resolution in 2019. And Jordan was our sort of last report back, if you will, and now is the time to kind of organize ourselves for everything that's going to happen to 2030. So much of this will stay the same. WHO and UNICEF will continue the very rigorous JMP monitoring and really trying to fill in a lot of the data gaps that we see on healthcare facilities. Monitoring will also continue on country efforts with the country tracker on the WASH and HCF site. There'll be regular progress reporting, and within the global plan that is currently being drafted, and which you will have an opportunity to look at and comment on, there will be targets again. So trying to make sure that we're all accountable and that we can see if we're on or off track as far as the efforts we're undertaking as a community. A lot of the kind of items that were talked about in Jordan are new, and that is this more comprehensive kind of understanding of resilient healthcare facilities, meaning electricity, clean energy, climate resilience, and sustainability. The one thing I took away from Jordan that I thought was incredible was there was this tremendous change to the extent to which the health sector and health actors engaged in the event. I believe there was more of them than WASH, which just shows you that there's really, I think the needle is shifting as far as understanding within our health sector, within the health sector. So as far as the timelines, a lot of this is happening quickly. The UN resolution is currently being looked at and drafted by member states. That will be available, or it's not available, but that will be, I guess, resolved to be voted on and agreed in October and November of this year. And of course, we need to respond to that. We can imagine that there will be a call by the UN Secretary General to regularly report on this, and to ensure that it is in health processes, like, for example, the Universal Health Coverage Global Summit that happens some years from now. But that would be very important. And then the global plan will kind of work with as well. So without further ado, I just wanted to say that because in Jordan, we had promised a drafting, and we're continuing that. So I'm just going to look to see our participants, our panelists, to see if we actually have Herbert Nabasa from the Ministry of Health in Uganda with us. Just give me a moment here. I'm actually not seeing the panel one right now. Herbert, if you are, please go ahead and come and kind of make yourself be known. Maybe I need to see the other view, side-by-side gallery. And I don't see you, so I think I'll go right ahead to Salvatore Vinci, who is a colleague, a dear colleague at WHO. Salvatore, if you're there, maybe you can turn your camera on, and I'd like to ask you a question, because I know this is something that you're very passionate about, and you're very much a proponent of electricity as a key service for ensuring quality of care. So I'd like for you to describe how you see greater collaboration and integration with the work on WASH and electricity and healthcare facilities. So go ahead, Salvatore.
Thanks, Bruce, and congratulations to you and colleagues for organizing this meeting, which again highlight the cooperation and the need of cross-sectoral cooperation. And I think indeed one of the key element is the need to increase cooperation between energy and WASH sector. For example, we have seen in the summit in Jordan that there are many similarities. One of those was highlighted by Maggie before in terms of gaps. For example, we have in terms of electricity access, we have 1 billion people worldwide that are served by healthcare facility either with no access to electricity or with unreliable access to electricity. And of course, electricity is useful. The kilowatt hour is useful only if help in addressing essential needs, and water, WASH is one of those needs, right? So electricity can be a key enabler. The positive element, the positive development is that in the past 10 years, there has been a huge development in terms of decentralized renewables. For example, the cost of photovoltaic system has decreased by 90% compared to 10 years ago. The cost of batteries has decreased by 60% in the past 10 years on average, obviously. This means that really today we have a balance of solution that was not available until a few years ago or was too expensive. And I think this is one of the elements where we have to push in the synergies between electricity and water. If we use I have a lot talking about energy. I have a lot of batteries. So basically, if we manage to increase electrification of healthcare facility using the solar system, for example, this is going to be a key enabling factor, also in terms of water and WASH. There are some key elements also in terms of how to do it, and in terms of challenging, right? One of the key elements, some of the key elements that emerged in Jordan, for example, was similar challenges in terms of data gathering, monitoring, in terms of financing. In terms of financing, the operation and maintenance, because this is, for example, one of the key elements that we cannot ignore when talking about solarization of healthcare facility. We have seen in many cases solar systems that have been installed, but since there was no budget or provision for operation and maintenance, the first problem, they have been abandoned. They are not working. One of the key elements is to ensure, including in the budget lines, that operation and maintenance for the operation and maintenance for long term, including the replacement of batteries. This is some of the elements. Another element was mentioned before by our colleagues, the key role of local capacities, local health stakeholders. So again, capacity building, data gathering, financing, operation and maintenance. These are all elements where I see huge synergies in addressing the WASH and the electricity system. So the summit was a key push for this, and looking forward to working together on that. Over.
Well, thanks, Salvatore, so much. And I mean, I think my take as well at the summit was people really, understood the synergies. I mean, both of these are basic services that are non-negotiable. They're prerequisites to quality care. And I think we're stronger together. And as we, I talked a little bit about the plan as we move forward and the resolution, and both those integrate clean energy. So we look forward to not only working with you, but the community that you're connected to. So now I'd like to turn to Paul Deverell from FCDO. Paul, I know you may not have had a chance to be at the meeting, but your colleague Lisa was. And of course, FCDO is a big kind of an active member, instigator, if you will, of the WASH and Healthcare Facility Task Force. And particularly on the issue of investment and streamlining with health programs. So my question today is, what should be the key focus of this revamped task force? And I guess you're always good at talking candidly. What would success look like to you? So over to you, Paul, and thanks so much for being with us today.
Yes, and thanks for the invitation. And it's a great shame that I missed the Jordan event, but Lisa, who's currently in Malawi scoping out work on systems, was there and came back with all the energy that I'm sure you are all infused with. Yeah, it's a really good question. Yeah, just the way I look at it is this: is that if you look at the audience here, we've got a very significant number of people covering a whole bandwidth of organizations and that sort of thing. But it's primarily technical. I'm technical, Bruce, you're technical, whatever. I think we're beginning to kind of map out exactly what's needed in terms of the technical side of this. I think the thing which is missing is the political aspect of it. I noticed that you have a global action plan, which basically houses the political messages, because global action plan is gap. And I suspect that is the problem in some respects. We have a gap there, and we're going to have to figure out how to fill it. The political aspects of this, the political leadership that others have referred to, isn't just a problem at local level. It is at national and frankly regional and international level as well. And that's what I think really needs to change. Now, how do we do that? That's a really good question. So we can start with WHO, a fine organization, many new ADGs. I see we have ADGs now, new ADGs, or maybe it's the old ones, I don't know, for AMR, for UHC, and of course for the healthier lives as well. So my first proposition is that we need to break some of the silos which exist between the various chunks of big WHO and get people to work better together. That's the first thing. Now, that to an extent is not going to solve the problem. That just means that we'll probably get more political attention, more resources, more action from WHO on this. And I'm not saying that's not, I'm not criticizing WHO. I think we can get more out of the beast than we are at the moment. Yeah, that's the first thing. The same applies to the UK. Now, the UK at the moment is writing a development paper, a white paper on the future of its development. If there is a call for evidence after this meeting, maybe go to the website, go to the UK Gov website, stick in Google call for evidence Gov UK, and then you can say if if you want to say we should do more work on wash healthcare facilities, then please do that. If that's your will, then please do that. But basically, we need to ramp up the political aspects of this also in many, many countries, not just donor countries, but also in all our partner countries that we work with throughout the world. The situation we have is untenable. It is crazy, but because it falls between the gaps in sectors, there we have a problem. And so that's why collaboration is going to be so much more important than it has been before. If we can get the political attention focused on this, then I'm pretty sure we can get the finance to follow through. Not just donor finance, but obviously finance from health budgets and beyond, thinking about sustainability. And then the last thing I say is that we should also see this as a climate issue. It's there's no point in putting in these facilities into a healthcare facility if they're not resilient, if they're not low carbon. So that gives us additional kind of arrows in our quiver that we can actually use. But it all goes back political leadership. And that's what I think we have to be working together on. Thanks.
Thanks, Paul. And I actually really appreciate using WHO and the UK government as illustrative examples, because I think change always does start with the organizations that you're in. There's so much we can all do. And I think it really does guide us that I think, when we looked at and heard some of the, kind of results from the meeting, the technical ones are, we're technical people. They're very interesting. They're needed. But to really get this ball moving faster, we need the financing and attention that comes with political support. So, Paul, that's really important, and look forward to working with you and colleagues on that agenda. Now I'd like to turn to Claire Chase from the World Bank. So hopefully we've stimulated you a little bit with all these discussion points. And of course, the World Bank, have been doing a tremendous amount here, and big thanks to you. I know the World Bank's been scaling up investments in healthcare facilities and building stronger partnerships across the health and water portfolios. So then the question to you is, what are the bank's plans for growing these investments? and supporting broader systems, strengthening and sustaining sustainable financing for WASH and healthcare facilities. Over to you, Claire, and thanks for being with us.
Thank you, Bruce. Great to be here, and really a great summary from all the participants, and a nice segue that Paul just gave me. I think first, let me just react a bit to what we see as the value of the summit and our participation. I mean, I think just reflecting on the Zambia summit that I participated in a number of years ago as the only World Bank person there, and I think the only financing institution. This time we were able to fund 8 World Bank staff, and that was drawing from both our water and health practices. So that sent a very strong message to our leadership. And we were also able to fund the participation of a number of countries where we're supporting WASH and healthcare facilities through the bank financing to participate in a summit. So I think that, again, was we were very pleased with our ability to really engage at this summit and take away the learnings from that and then bring that back to our leadership. So I think just a few of the messages that we brought back that I wanted to share, because I think it's relevant for this discussion. I mean, firstly, recognizing that the bank is the largest multilateral source of financing for water in developing countries, we really need to step up our game on this agenda, and working through our global health portfolio, which touches projects in 240 countries. So, and totals over 25 billion. So we're looking at how we can take advantage of that existing portfolio. We've already been doing that work over a number of years, but there's a lot of low-hanging fruit that we can really work towards. And then secondly, again, that the show of support from both the water and health practices at the summit, I think that helped to really re-energize our collaboration with the health practice. We had, a lot of work jointly throughout the COVID pandemic, but coming out of that and now seeing how that has reframed this discussion on WASH and healthcare facilities has helped to sort of bring this back to the attention of our leadership. So we have a number of upcoming opportunities. One of those is a joint leadership team meeting between our global director and the global director for the health practice. We're also working on a webinar to debrief our colleagues on the summit and some of the experience that's happening in our operations. And then finally, collaborating on some analytical work that was shared on the damage costs and the financing. So all of that is sort of the background is sort of running in the background. But what I really wanted to share today, and I think is most exciting, I think for this group, is the discussions that are happening at the bank now on what we're calling the global priority programs. So this has come out of the new president's agenda, looking at how the bank can evolve to address some of the more, the challenges that we see today, much of that having to do with climate change, of course, and how do we restructure the World Bank to address these global challenges. So there were around, I think, 10 or so global challenges that had been identified. And then there were priority programs attached to those global challenges that were put forward to the World Bank leadership and the board. And we've just learned in the past couple weeks, actually, that the water security and climate adaptation global priority program is one of the 5 that have been identified as a pilot that the bank will take forward. So that I have been at the bank since 2008, so for 15 years, and I've never seen the water sector elevated to this level of priority in the institution. So I think that's been hugely exciting. And and of course, a big part of that we're pushing for, it includes water resources management, water and agriculture, sort of the broader water sector. But of course, a big part of that will be water and sanitation access, and a component of that on universal access, WASH and healthcare facilities. Now, another global priority program that has been prioritizes the health emergency prevention, preparedness, and response. So with these two programs, we're really looking at now, how do we articulate and put some figures, targets, and objectives that are very specific on what these two programs can do together. So we're taking advantage of the work that had been done with this group a couple of years ago on the costing to really look at, first of all, how much progress are we currently making within World Bank financing? How can we accelerate that, and how much more financing can go towards it? And it's not just World Bank financing, because we really need to leverage the other sources, both the public and private sources of financing, because we can't do it all. There's a much larger need than we can manage to address. So that's all still in the works, but the plan is to announce these global priority programs at the annual meetings, and then we have to do our work to prepare the board papers that will go to the board in Q3 of FY24, so early next calendar year. So look forward to feedback and continuing to work with the task force and others on the call as we progress with this. So thanks so much.
Okay, thanks so much, Claire. I'm realizing now we're at just about time, but I think your words are a nice way to kind of conclude this, because at the end of the day, I think what we're seeing here is we're seeing real, I guess, commitment. Some of these high profile initiatives you mentioned that you shared that the World Bank is taking forward are going to be tremendously significant. So I'm just seeing that each of our institutions and the people involved are what make, kind of what are going to change things ultimately. So we have the people and the institutions to make change. And I think, as Paul said, I mean, that will in itself, with collaboration, bring political support. And we'll definitely continue with the technical tools. That was a big part of it. We, of course, are working hard to get more financing toward this, more integration, and making sure that everything is climate resilient as possible. So I think the future is bright. I'll just close by saying that I think it's when we started this journey years ago, I always felt that it's almost easier to start something than to kind of continue it. And yet I'm very pleasantly surprised about the momentum that we're seeing as we move in on this, after maybe even a decade of work. So it's just and it's all thanks to you, and particularly some of the new faces, as well as those that have been involved from the outset. So thanks so much. And this is just the beginning of a kind of revitalized discussion. We said in the slide, the revolution is not over. And it is certainly not over, thanks to all of you. So with that, thank you for your time. Thanks to all the presenters for sharing their insights about the report and about Jordan, and apologies if we weren't able to answer the questions, but we will continue to share information, so hopefully things are clear. So with that, have a very nice rest of your day, whether it's evening or morning. Take care. Bye-bye.